Hello, I'm Joel Harrison with EliteHRTeam.com. Today, I'll be discussing cost containment strategies for 2014 and beyond healthcare market. Before we talk about cost containment, it's important to understand what has changed in health insurance thanks to the Patient Protection and Affordable Care Act of 2010. So, ACA 101 in less than 60 seconds? Here we go. The main design of healthcare reform was to make health insurance better for everyone, and that has been done in some ways. Every health plan now must pay for maternity, mental health, and substance abuse coverage. Out-of-pocket costs have been capped at $6,250 for an individual and $12,500 for a family. Many preventative services and wellness visits are now free. Prescription medical prices have dropped significantly. No one can be denied health coverage or rated up due to current or pre-existing health conditions. The government is also giving money to individuals to help them pay for health insurance premiums and in some cases out-of-pocket costs. However, if you don't have health insurance, you will pay a penalty equal to 1% of your income and you are not guaranteed care when you go to a facility. With all of these changes, as I'm sure you can imagine, there are some side effects. High cost being the biggest and most problematic. So how do we deal with the rising cost of healthcare? Intelligent risk management, that's how. Please note that the ideas I'm about to discuss are viable in both individual and group healthcare markets. Business owners, for you, there are lots of options for dividing up both cost and risk for both yourself and your employees. So please, after you hear the basics here, please fill out the healthcare questionnaire and I'll get right to work on the best solution for your business. The best way to decrease your monthly premium payments is to raise your deductible. Doing so puts more low-end healthcare costs on the individual. Of course, if you accept more risk, you save money. And in the worst case scenario, say you get a $100,000 hospital bill, you're only going to have to pay $6,250 of it per individual. Not really that bad of a deal. These plans have become more viable today than they have been in the past thanks to low-cost prescription drugs and free preventative and wellness services. To illustrate the concept, we will use two comparable insurance plans. Both have around $6,000 total out-of-pocket costs for the year. But Plan 1 has no deductible. You pay 25% of all costs until that 25% equals $6,350. And Plan 2 has a $6,000 deductible and covers 100% of everything after that. Plan 1 costs $345 more a month. That's over $4,100 a year in total savings. High deductible plans do leave the insured with a lot of exposure. So in a few minutes, let me show you a few strategies that we can use to manage some of the more common and more expensive risks to find a middle ground with a smaller monthly premium payment than Plan 1 and less overall risk than Plan number 2. Anytime you are thinking about risk, savings should always be in the discussion. A health savings account is a great idea to plan ahead for medical expenses. First, you must buy an HSA-eligible insurance plan. These plans do not have copays for doctor visits, so they are perfect for people who are generally healthy and rarely go to the doctor. Why should you pay for the copay if you're not going to use it? Once you have the proper insurance plan, you can go to the bank and open your very own health savings account. You can put money in, grow money, and take money out tax-free as long as you pay for a qualified medical expense. You have to pay for it. Might as well pay for it tax-free. However, please remember, accounts do have limits. $3,300 for an individual and $6,550 maximum contribution for an HSA account for a family. Now that we have some savings to help pay for some medical expenses, we can manage specific risks to lessen financial exposure. The most common insurance claim is due to an accidental injury, and if you have kids, you know this is true. So an accident plan pays your out-of-pocket costs due to an accidental injury. For about $60 a month, this family is 100% covered for all injuries. Heart attacks, strokes, and unfortunately cancer are on the rise. Almost 1 in 3 people will be diagnosed with cancer or heart disease in their lifetime. These conditions are very expensive and will not only eat your out-of-pocket expenses, but could cost you a fortune in non-medical expenses, such as travel to see a specialist, food, lodging, time off work, bills, experimental treatments, and other things. Wouldn't it be nice to get a big stack of cash when such a hard life event happens, not only to help pay for your expenses, but to help you recover properly without financial worry? The most comprehensive way to cover gaps left by high-deductible plans is a hospital indemnity plan. This plan combines elements of both accident and critical illness, along with benefits for hospital stays, surgeries, and other benefits. These plans are usually a more viable option for small businesses than individuals. However, individual cost-benefit analysis is the best way to determine what best works for you and your family. So if we put the whole picture back together, we still have the same 2 original insurance plans. Plan 1, 0 deductible, and you pay 25% of all insurance bills until you've paid $6,350 per person. Mind you, up to that $12,500 max. Plan 2 has a $6,000 deductible, but if it's an accident, it's free. If it's a critical illness, heart attack, cancer, stroke, or other, it's free, plus a stack of cash. If it's preventative health and wellness, it's free. If it's generic medication, it might be free, or it might only be $4. Yes, there is still risk involved. However, holding more risk on the less likely conditions and managing the risks that are most likely to happen, we have lowered the overall exposure. And remember, we still have the health savings account that can be used to pay for what risk left over tax-free. Putting this plan together as an insurance package instead of just an insurance plan saved this family of 4 almost $1,500 a year. Is this the best strategy for everyone? No. Might it be right for you or your business? Absolutely. The only way to know is to look into your individual situation. Every single one is different. I'm Joel Harrison with EliteHRTeam.com, and I'm here to help. Contact me anytime. Thanks for listening. Have a fantastic day.